Hi, I'm an intern at Leadership Initiatives. My name is Mackenzie, and I will be diagnosing you today.
Hi, how are you?
Good. How are you doing today?
My name is Dr. Amis Abbas.
Okay,
I'm
thank
with
you.
the patient. I'm with the patient here.
Okay,
Okay. So I'll serve as an interpreter for you between you and the patient.
mhm, sounds
You
good.
ask me, yeah, you ask me, I'll ask the patient, and then at the end, you tell me what you feel and how
Mhm,
you are going to treat the patient. Then we'll now discuss. Okay.
thank you.
All right. So the patient is here.
Mhm.
Okay. So the floor is yours. Go ahead.
What brings you in to care today?
Make it up with you. Without you.
I can't understand that. Oh, I'm sorry. Could you repeat that?
I'm asking the woman. I'm asking the patient. Make it up with you. I think it. Okay. That she come with a complaint of abdominal pain.
Abdominal pain? Okay. Is there any fever present?
Okay. Because I think it. No fever.
No fever? Okay. Have you been vomiting at all?
Okay. Can you am no vomiting?
No vomiting. Has there been any diarrhea or constipation?
Akwai zawo ne ko no constipation, no diarrhea.
Okay. Are you feeling any dizziness or lightheaded?
Okay. Kina jin jiri ko ciwon kai? Yes, she felt dizzy and headache.
Okay. Are you feeling especially dizzy when you stand up?
Okay. Wai kina jin jiri in kika tashi?
Yes.
Yes, she
Okay.
feel dizzy
Okay.
when she stand up.
Can I ask who you live with at home?
Pardon?
Can I ask who you live with at home?
Okay. Oh, I kawo ki wa dai kake gida. And somebody will be taking her home already.
And then, has there been any chest discomfort, coughing?
Okay. Akwai kirji na ciwo ko kina tari? Hmm? Da kina yi? She was coughing before, but there's no coughing. I checked his comfort now.
Okay. When did the coughing start and when did it end?
Then yaushe tarin ya fara? Ya bari. Hmm? Abin kwana nawa? Ya kai kwana ya kai sati? Kwana uku ko hudu. Like the cough started like 5 days ago. That
Mhm.
stopped yesterday.
Stopped yesterday? Okay. Um, are you experiencing any runny or stuffy nose or any congestion at all?
Kina mura ne ko kina yadda magana ko atishawa? No
Okay.
running nose, no sneezing, no congestion.
Okay. Can I ask what your diet is like at home?
Okay. Me kika ce yawanci haka a gida? Most of our diets are in form of carbohydrate,
From what? Sorry.
carbohydrate diet.
Okay. Okay. And you said there is no constipation, diarrhea, or vomiting, but there's just discomfort in the abdominal area?
Yeah.
Can we run a blood count test?
Yes, we did blood contest.
What were the numbers for hemoglobin?
Hemoglobin is I think it's 36.
36.
Sorry, it's
Um,
48. 48.
48. Okay.
Yes.
Um, and you said you're feeling dizziness and lightheaded, correct?
Yes, yes.
Okay. Um, based on my suspicions, based on your abdominal pain, but you don't have any fever present, you don't have vomiting, diarrhea, or constipation. I would say that you would have nutritional anemia, especially due to the lack of iron in the diet. So the treatment,
Okay.
or sorry,
Go
you can.
ahead. Go ahead. Go ahead.
The treatment that I would recommend would be oral iron supplements and vitamin C on an empty stomach, and then if needed, parenteral iron through an IV. But we can start with that care and see if the symptoms get better, especially the lightheadedness and dizziness.
Okay. Excellent. Any other thing?
Sorry.
Any other thing you want to do to the patient?
Could we, has she experienced any discomfort in her chest?
Not really.
No? Okay. And her cough, was it a dry cough or was there any mucus when she had the cough previously?
Okay. Tarin da ke zallan kina fitar da kaki ne ko wani abu? Okay. It's productive of yellowish sputum.
Okay. Could we do a chest x-ray to check for a lower respiratory tract infection?
Yes, we requested for it, but it's not ready.
Nothing? Okay. I'm going to say, I believe, based on what you've told me, that you have nutritional anemia. So, like I said, the treatment for that would be oral iron supplements, vitamin C on an empty stomach in between meals, if possible. Um, and then another great thing to do would be to increase iron in your diet. And you can do this by eating lean red meats, fish, if you can. Any leafy greens would help with that.
Excellent. You did well. Okay. That's excellent.
Thank you.
But this patient actually, uh, the diagnosis is that of enteric fever. That's typhoid.
Okay.
Okay,
Mhm.
typhoid, and then also with upper respiratory tract infection.
And upper respiratory tract?
Yes,
Okay.
because the patient come with complaint of abdominal pain,
Mhm.
and then there was past history of cough, and then the
Mhm.
fever. She had fever at a point where the fever subsided. Maybe she had been taking antibiotic before coming.
Okay.
Okay, and with the cough that's productive of yellowish sputum.
Okay.
Okay,
That makes sense.
and then the investigation that was run shows titer for typhoid fever are significant. Okay,
Mhm.
and then the malaria parasite is 1 plus, and the PCV is 48%. That rule out anemia. Okay,
Okay.
so based on that, we're managing her for uh, community acquired pneumonia with enteric fever, typhoid fever. Okay,
Okay.
and currently on antibiotic and anti-malaria, and she's doing better.
Okay. Doing better. Okay.
Yeah, that's diagnosis. Okay,
Okay. Thank you.
what do you want to tell her as preventive measures for typhoid?
Preventive measures for typhoid in the future?
Yeah, yeah,
So to prevent typhoid in the future, I would recommend washing your hands after you,
excellent, good,
making sure that your water comes from a clean source. And if you don't have a clean source of water, you can boil it for 10 to 15 minutes, let it cool down, and it should be safer to drink. Um,
excellent,
Making sure that there's safe handling of food. So also making sure that the people cooking your food, or if you're cooking your food, are washing their hands before they cook.
excellent. Right. You did well. Okay, that's definitely. Anything you want to tell the patient?
Thank you so much for meeting with me today.
Okay, that's a good shape without going. This answer is say thank you to.
Thank you.
Bye bye. Have a nice day.